that all right? Okay. May, do you want to spend a little time kind of updating folks on who we had visiting and where things are on the breast cancer project side?
Yes, let me just share.
And May is one of our second year medical students, and just asked her to give a quick overview. It's happening there, so go ahead.
Can you guys see the presentation?
Yep,
Perfect.
looks good.
So I'm just gonna talk quickly about what's happening with the tumor board. And so in case people aren't familiar, breast cancer is one of the most commonly diagnosed cancers in Mongolia. In Mongolia, they're usually diagnosed at a very late stage, which actually leads to a very high mortality rate. And a lot of studies have been up to 88% mortality. And so we have been working to establish a tumor board, which has been established about 1 to 2 years ago. And so tumor boards are interdisciplinary teams that kind of review a breast cancer case and provide recommendations for the future patient. And these meetings typically have surgery representatives, oncology, radiation, pathology, and radiology. And so the National Cancer Center of Mongolia previously did not have one. And so through the University of Utah and the University of Minnesota, we have been able to develop one over Zoom that meets once a month. And so the last kind of batch of research that was going into this talked about like what kind of cases were brought into the tumor boards, including like the diagnosis, the staging, the tumor receptor status. And so I'm just going to talk to you guys a little bit about what we're looking at now. We are still at the beginning, so there's no results, but I'll just let you know our aims. So the first one is we wanted to see if these tumor boards were actually multidisciplinary. We have proof from like previous data collection that from the University of Utah and the University of Minnesota, all the different specialties that I listed previously have been attending each and every tumor board, but we have been unable to do the same for the National Cancer Center of Mongolia. And so the next step would kind of be to take roll of these meetings, who is attending from the Mongolian side, what specialty do they belong to? That way we can kind of figure out if it's like a comprehensive representation, and that would allow the different specialties in the National Cancer Center of Mongolia to have an opportunity to learn about what happens in the tumor board as well, and kind of engage that way as well. The second aim would be to kind of ensure that everyone is on board and agrees with what the staging of the patient is. There have been discrepancies in the past, so we just want to kind of compare what the Mongolians have been saying and what the tumor board has been saying. So in order to do this, we have kind of made a spreadsheet to send out to the Mongolian fellows that they would fill out before the tumor board each month to talk about what clinical staging and pathological staging they think each patient is. And then after the tumor board, we would fill out what was agreed on during the tumor board. And that way, like if there are major discrepancies, we can kind of talk about them with the Mongolians, see where the problem lies, and that way we can ensure that like staging does become uniform. And then our third kind of main, which is our main objective, is just to kind of determine what happens to the patients after the tumor board. The main question is like what happens? Do the tumor board participants tell the recommendations to the patients? Do they tell the recommendations to other patient care teams? Like who is getting the information, and is it going anywhere past the tumor board? Also, if they are kind of spreading the information, how are they doing it? Are they doing it through like a phone call, email, face-to-face? We're not really expecting anything over the other, but we just are curious to know what their common practice is. And then the other thing would be to kind of think about what the patients and the physicians think about these recommendations that we're providing them. For example, like if we were to recommend a different type of chemotherapy, are they following through with the treatment? Kind of why or why not? Do the physicians follow the recommendations? And this could be, they could not follow the recommendations for a number of reasons. For example, in other countries, like patients will refuse a mastectomy just because the woman feels incomplete without her breasts. And so this would kind of just give us a better insight into which recommendations are being followed or not. They also mentioned that a lot of times they don't use the chemotherapy drugs that we recommend for them just because they're not accessible at all. And so this would help us to give them better recommendations that they could actually use for their patients rather than us using the ones that we are used to using here. And so then we are still at the beginning steps of the research, but we're excited to learn about how we can improve it. And so thank you for your attention. And if you have any questions.
That's fantastic. Thanks so much, May. Are you planning on doing this prospectively? I know that one of the challenges in Mongolia, as it is in many places, is that there is not an electronic health record, or there's not a mechanism to go back and look at the last 3 years worth of tumor board participants
No,
to kind of look at answer this question. So presumably it would have to be either done respectively or with some real-time investment to look through the charts and figure out the answers to this.
no, it's going to be with real time. And so the patients that we're starting it based on the patients that were presented on in January.
Right.
And then every couple months we'll meet with the Mongolian fellows just to ask about what happened with the patient, what did you do, and things like that.
Right. And
No.
it seemed like some of these questions are also quite qualitative. Or will you be analyzing some of this data from a qualitative standpoint, kind of looking at major themes, like you mentioned, like cultural disparities? Do you plan on collating the data in that manner?
You cut out for the last part. Could you say that again?
Are you planning on collating the data in that manner, where you're looking at different themes that are current and that are coming out more qualitative?
Yes, I think we're trying to focus more of whether it's like a cultural thing, an access thing, financial, and just kind of determine from there why they aren't using things.
Sorry, I'm just going to jump in, May, really quick. So we have created a spreadsheet with them on which we have all those questions, both qualitative and quantitative. And we are going to work with them to fill that out. And that way we will collect all that data. And May is working on all that with them.
Great. And that certainly is some quantitative data that's coming out, but there are probably also qualitative data.
Yes. But May mentioned like we're going to ask those questions in that spreadsheet too for them. And then we will meet with them and discuss those things.
In your spreadsheet that you've developed there, have you had input from the fellows there to put that spreadsheet together, or is this just put together here?
So we worked with Dr. Bronson on that, and we did share it with them in the start, and like if they are okay providing us all that information, and so far they are okay. But
yeah, so I'd actually recommend that you actually, maybe even target one of them over there, or not target, but have one of those participate as a co-investigator in it that will help that be a little bit more successful as well. Just really want to select who that might be over there.
that's a good suggestion. Thank you.
Great point.
I would like to know the little details about logistics. So you said this meeting happened once a month through Zoom. So I know that there is huge time difference. So how is these things happening?
It happens at, I think it's 6 p.m. Utah time, which is 7 p.m. Minnesota time and 9 a.m. Mongolian time.
Okay.
Yeah.
And when you say, yeah, go ahead.
Yeah, 9 a.m. the next day for Mongolia.
Okay.
Yes.
And then when you say Mongolia, is it like the whole country or just one particular medical institution?
So it's the National Cancer Center of Mongolia, but they receive, it's in Ulaanbaatar, but they receive the majority of cancer patients from across all of Mongolia.
Okay, so it's one institution that you're dealing with.
Yes.
Okay. Thank you.
Great, and that's the main institution that's the main referral center for breast cancer care anyway, so that's the place to start. So fantastic. Well, great work, May, and I'm sure Dr. Brownson will be super happy to see what the results are. This has been going on for 3 years now, and we just hosted the head of breast cancer from the National Cancer Center of Mongolia, which is really a program that's only existed for the last 2 years in that country. So, you know, all these are baby steps, but hopefully they're baby steps towards better care, better access, and better programs there. So, fantastic. Nice job, May. Thanks for sharing. Any other questions or comments from anybody else? And just a quick shout out. I don't know if Eric Wallstead is still on, but he and Dr. DeVries have been working on a paper that was just accepted for publication. Thanks, Eric, for sharing that news, and congratulations. And that's on, I guess it's on technology and surgical technology and renewable technology and waste generated from use of surgical technology, et cetera. But look for it in World Journal of Surgery. So if anybody's interested, let us know. We'll send you the article when it's published. Congrats on that. All right, great. I think that's mostly it for today. Anybody have any other questions or comments? Awesome. Well, thanks for joining today, and thanks for presenting for both our presenters. And see you all next week.
Sorry, I can see Daisy's hand is up.
I'm sorry. I don't know if Mary meant to be talking to us. And next week, I believe Dr. DeVries will be talking a little bit about urology and the urology task force that she has been working with to increase pediatric urology capacity in Western Africa. So thank you for joining us today, and see you next week if you're available. Bye. Have a great one.
Thank you.